The opioid crisis is hurting communities across the country, and here is no different. Most of it is fueled by fentanyl, and it is affecting everyone, including children. State data shows that the number of teenagers going to the hospital because of an overdose is on the rise. But as WCCO's Caroline Cummings explains, some schools are taking a proactive approach to keep students safe.
Here they come.
Kids at Oak Grove Middle School flood the hallways at dismissal, a school that looks and feels like most others, except hiding in plain sight. The extra life-saving measure that administrators never want to use sets it apart.
And every kid has 2 doses of Narcan within it. So
all Bloomington public schools are stocked with the opioid overdose reversal drug, naloxone, in some form. The middle and high schools also have Narcan, the nasal spray version.
Our implementation was not in response to something that happened within our schools. It was a proactive measure.
Schools are a microcosm of our community. If it's happening in our community, we can expect that it's going to happen in our school districts.
Director of Health Services Hannah Hatch and Emergency Response Director Rick Kaufman led that effort, the policy enacted in 2019. Since then, state data show hospital visits for overdoses among school-aged children, mostly teenagers, have shot up. They've nearly tripled since 2016.
I think 4 years ago, I don't think we said 4 years from now this is what we're going to be dealing with. It really was, how do we approach the issue of overdose and use and abuse of drugs and alcohol by students, and what programs, what resources do we have in place?
Kaufman says staff in the district haven't had to use Narcan on a student, but they have had close calls. On one occasion, EMS administered it to someone in the ambulance after being called to school.
The benefit that we've had of implementing it years ago is it's freed up some of that room for us to focus on, okay, we have that last ditch effort, we have that life-saving measure. Now what can we do more proactively? What can we implement more to support students?
Well, Bloomington Public Schools have implemented this for 4 years. Hatch says interest from other districts really spiked this fall, with more than a dozen reaching out, wondering how they can make it happen too.
The state legislature could help with that. State Representative Kelly Morrison vows to reintroduce a bill next year requiring schools keep a supply on hand.
Why, if we could prevent a single death in our schools, why wouldn't we do that?
Morrison says the proposal would include state resources to pay for the medicine. Right now in Bloomington, covering it comes out of their own budget.
We have a lot of bipartisan support for this measure, so I'm hopeful that we'll be able to get it across the finish line.
We know it works. So what better evidence do you need to know that we could be saving a child?
Caroline Cummings, WCCO 4 News.
If approved, Minnesota would join a handful of other states requiring naloxone in schools. The policy has the backing of the National Association of School Nurses.